a story about one of the patients with polio who just had everything stolen. She had a black eye, she was hit with a metal rod, she had all her medications stolen. We gave her an eye appointment referral, we gave her all the medications, but we didn't have a place for her to stay. We didn't have a recommendation.
The street medicine rotation is a 2-week hands-on community-based rotation where our residents go out and work with Healthcare in Action to really take care of patients that are experiencing homelessness. The motivation to start the street medicine rotation really came from lived experience from our physicians and our residents. And a lot of us were seeing patients that were coming to the hospital. We took care of them, their medical needs were addressed, but then they would leave the hospital. Our traditional care models aren't really addressing patients that don't have access to food, to housing, and to medication.
When I imagine street medicine, I imagine a few doctors carrying backpacks, going encampment to encampment, seeing patients. But in reality, it was very well coordinated and very well resourced.
It's awesome to see just second and third year residents coming out with us and experiencing a lot of different care that they don't experience necessarily in the hospital, and seeing really what it's like outside of the hospital versus inside the walls of the hospital.
It gives our residents the skill set to be able to think about, how do I come up with a care plan for someone that doesn't have a refrigerator, that doesn't have transportation to go to follow-up appointments, and might not be able to access our traditional medical system. And then it also really addresses caring for patients where they are and providing the care when they need it and how they need it.
Really seeing people go from a state that's unsupported is really looking just dire overall from a clinical perspective, and then seeing just that turnaround. We're seeing changes in habits, adherence to medication, and re-engagement in just positive behaviors and actions that really have helped people get to permanent housing, whatever the permanent housing may be.
This experience was really inspiring. And I was so inspired that I actually started doing health workshops at the shelter. And so every other month we do health workshops there, talking about diabetes and hypertension and whatever the clients want to talk about.
We can't separate health from food, housing, and safety. These are linked and connected. And by just prescribing medications, we're really only addressing one small aspect of a person's health. We need to think of their totality, the places that they live, they work, they play, to really understand, how can I come up with a plan that really meets this person's needs.
My takeaway from the experience is it doesn't take a lot of people to make a big difference.